Thanks for joining us on TVC News at 1, reaching you live from our headquarters here in Lagos, Nigeria, where we are monitoring events across the globe. Now, we'll begin this hour in Nigeria's capital city of Abuja, where the Minister of Labour and Employment, Ngige, is opposing a bill seeking to mandate medical and dental practitioners to undergo minimum of 5 years of service to obtain a full license. The minister said the bill before the House of Representatives, which seeks to amend the Medical and Dental Practitioners Act, amounts to killing a fly with a sledgehammer and putting shackles and chains on the leg of the doctors. He added that the sponsor of the proposed law is not acting on behalf of the executive arm of government. The minister explained that a private member's bill in the National Assembly comes from either a legislator's constituents or is authored by the legislator after a discussion with people in the concerned constituency who agree that the proposal is the solution to their problem. He argued that it will be better for the Federal Ministry of Health to look to the fees paid in medical schools and put those who could not pay on bond when necessary. Now, for more on this development, we have the Vice President, Initiative for Africa, Dr. Agbo Ibuta, who joins us live via Zoom from Abuja. Good to have you join us, Dr. Agbo.
Thanks for having me, Precious. You're welcome.
So this conversation has been going on for some weeks now. Everybody seems to have some level of reaction or some kind of reaction to it. But this is the latest, and it's coming from the Minister of Labour and Employment himself. What's your thoughts on his recent comment that, look, this is using a sledgehammer to kill a fly? Dr. Agbo, can you hear me?
Yes, I can. I can hear you loud and clear.
All right, I was asking you for your reaction to the minister's comment.
Well, I would want to create a context first. There's a global health human resource crisis brewing presently and has been brewing for a couple of years now. The UK has 280,000 doctors plus or minus, but as of today, they are in deficit 50,000 doctors. The US has 1,070,000 doctors, but they are in deficit over 50,000 doctors. Canada has 100,000 doctors, but they are in deficit over 30,000 doctors. As we speak, the NMA has confirmed that there are 24,000 active practicing physicians, doctors in Nigeria. Based on our population and WHO recommendation, we require 370,000 doctors. And you heard me right. That means that we presently have only 6.5% of our requirements health-wise. So there is indeed a crisis going on, and people will continue to migrate to climes where there are better opportunities, as the case may be. So I can understand where Honorable Ganu is coming from because of the fright at the rate at which doctors from Nigeria are migrating. And that is why he came up with his bill. But his bill was due respect to him, was not comprehensive, and it was not well thought out, and it did not involve key stakeholders of the sectors to understand the issues clearly. Because as we speak right now, what we need is a comprehensive surgical approach to dissect and analyze what the issues are. What do we need to attract, to retain, to motivate, and to consistently develop health talents and keep them in this country? That's the question we need to be asking ourselves. If you decide that you want to keep young doctors for 5 years before they leave, it means that you are keeping the young doctors whose experience is still even being built. So if you want people who would contribute to the health sector in Nigeria, you need older doctors or doctors who have developed some level of skill over a couple of years.
Dr. Agbo, our understanding is that it is those older doctors that are leaving and not necessarily the young doctors.
Interestingly, every strata of doctor is leaving Nigeria for several reasons. The young doctors are leaving because we don't have enough training opportunities. They are leaving because even when you are done with NYSC, for you to get a job, to mainstream yourself into government, because government is basically the highest paying organization right now. If you go to work for private, you probably, a young doctor starting up in private, depending on where you are, may earn just maybe 150,000 naira. But that is a little more for in the government sector. But the opportunities are simply not there. There's a ban on employment of people generally. Even in the health sector, there's some subtle ban, so to speak. It's only the federal government that pays something substantial to doctors that may not even be competitive if you put it on a global scale. But and then the older doctors, I mean, a doctor who leaves Nigeria today to the West or to UK or to Saudi Arabia experiences an immediate significant jump in the salary from as much as 500,000 to 1,000%. It means that if you, whatever you earn in Nigeria over a 7 to 10 year period, you can earn it in a foreign country in the West over a 1 year period. So that is quite attractive, but it's not everybody that is living. So that's why I say it is a human resource challenge, and we must look for a very strategic approach to attracting, retaining, and motivating. And what do we need to do? We need to look at funding for health. It's a health system thing. What are we doing about funding for health? Consistently, we have consistently budgeted less than 5% of our gross national budget for health. And we agreed many years ago in 2000, after the Abuja declaration, that we were going to budget 15% of our gross national budget for health. If you are budgeting less than 5% of your gross national domestic product or your budget, you cannot pay the salaries that would retain. That is just one aspect. How about funding infrastructure, distribution of services, and spread? If you look at it critically, what is the distribution of service? The doctor-patient ratio in Nigeria is 1 to 10,000. But I put it to you that in some states in southern Nigeria, you have as much as 1 doctor to 30,000, and in the north, you have 1 to 45,000. So it's not just about coming up with a bill. And it's not doctors that are leaving. Nurses are living in droves. Pharmacists are also living in droves. So we have a complete health system challenge. And this challenge is a human resource challenge and is due to an increase in the global demand for health resource. But this is also an opportunity. I think that government can develop a policy to increase the number of health workers Nigeria produces. Nigeria has a population of 220 million people. We can become the epicenter of developing human resource to serve the whole world. If you develop and produce more human resource, you will have enough people who will decide to stay back in Nigeria, like some of us who do not want to japa at the moment, and those who want to leave to new countries, and they will be involved in many things, remittance, brain gain activities. Nigerians in diaspora remitted $20 billion in 2021. Part of that money, a significant part of it was from health workers who are working abroad and who are among the highest paid. So we must come up with a strategy that in the next 4, 5, 10 years...
And I like that you said, sorry to jump in, I like that you said particularly that, look, this must be seen not just from the medical doctor's approach, but from it has to be looked at holistically as a health crisis, and there has to be reforms in that regard. Thank you so much for talking to us, as always. Always a pleasure. Vice President, Initiative for Africa, Dr. Agbo Ebuta.
Thank you.